I have been doing simulation since the 60s, and through my career in the military and my career in health education and nursing education, have been using simulators for somewhere close to 50 years. The transition from the old SimMan classics to the first SimMan Essential, almost immediately faculty began to say, oh, I think I can figure out a way to use this. One of our graduate faculty who teaches in our family nurse practitioner program said, you know, I've got this great scenario where the SimMan is now sitting in the provider's office, and then the students are asked to, of course, assess the patient. Well, all you can do in the physician's office, the provider office initially, is assess heart sounds and a pulse. So we set it up so that he's got an irregular pulse with just a hint of a murmur. From there, they need to take both the history that they've taken from the patient and the physical exam that they've done on the patient and make the determination that this patient needs a 12-lead EKG. At that point, we're able to come in, put him on the monitor, show them what the monitor would look like with a rapid ventricular response, atrial fibrillation. And then, because the mechanism on this thing is so advanced, we push the 12-lead button and it shows us what his 12-lead would look like in that rhythm. So the students are then able to read the 12-lead, make the diagnosis, and provide a treatment plan for a patient who's presented to their provider's office with a new onset rapid atrial fibrillation. So a fabulous use of high fidelity technology in an outpatient setting. Of course, we use it very traditionally as well for all of the mock codes that we do. Our acute care nurse practitioner students work with him in a variety of scenarios, seeing those things that they can't get the volume and variety of exposures they need in their clinical setting on a routine basis. The most exciting thing that we're doing with our SimPads and with our SimMan Essential is we're creating a hospital ward because they're all tetherless. We can operate them from a distance, watch in on closed-circuit television, and we're giving our undergraduate students the opportunity from the very first course in nursing, the opportunity to begin to have interactions with providers, to learn about the importance of teamwork, and to give our provider students, our acute care nurse practitioner students, an opportunity to learn how important it is to interact with the bedside nurse, and that the bedside nurse is the holder of knowledge. Right now, with the new NCLEX study that's just been published and come out, the follow-on to Pam Jeffries' work, that we can substitute, and the National Council of State Boards saying we can substitute up to 50% of clinical time with simulation. I see us profoundly expanding what we're doing and making better use of the personnel we have available and making better use of the sites we have available, both in the actual inpatient clinical settings and using simulation to significantly improve and advance what we're doing as far as clinical exposure. And I believe it's going to make better clinicians, better outcomes, and increase patient safety significantly. I see simulation being an integral part of healthcare education.